Hi, today let's talk about some prenatal testing and screening options that are available in pregnancy for a variety of reasons to have testing. The first we'll talk about is chorionic villus sampling. So let me introduce myself. I am Cathy Lawson and I'm a genetic counselor. I have had the privilege of walking family planning journeys with many individuals, including people in your position. So thank you for the opportunity to be part of your journey today. Chorionic villus sampling is essentially a placental biopsy. It is performed in the first trimester of pregnancy and often is done either through the cervix, in other words, through the vagina, through the cervix into the uterus, or it can be done abdominally, where a needle is inserted through the abdomen and a small piece of the placenta is withdrawn that way. Most people say the discomfort associated with the procedure, if done vaginally, is like an uncomfortable full bladder pap smear. And abdominally, the discomfort is a little bit of cramping, like menstrual cramping, for about 45 seconds. So this is a procedure that's typically done in an outpatient office visit, not in an operating room or anything like that. It's pretty straightforward. The placental tissue reflects basically the same genetic material as the fetus. So 99% of the time, those things are the same, the placenta and the fetus. So it can tell you the predicted genetic sex of the fetus. For X-linked conditions, it can also tell you that if the fetus is male, does the fetus have the genetic condition of interest? And if the fetus is female, is the fetus a carrier for the genetic condition of interest? The types of testing we can do on the specimen include a standard, what's called karyotype. So this picture here on the right is a picture of chromosomes, and there are 46 chromosomes here. Typically, as you probably all know, a female has 2 X chromosomes, which is the bigger chromosome here in the bottom right, and a male has 1 X and 1 Y, which is what's shown here in the picture. Standard chromosome analysis on any specimen takes about 10 to 14 days and does not include analysis for the condition that might be running in the family. That would require additional testing. If the fetus is found to be a male and then someone would want to test for the condition in the family, then additional testing can be done at that point. We can also do a test called fluorescent in situ hybridization, or FISH. This is a test also done on the same specimen that we get from the CVS. So we get one specimen of the placenta, and these are the various tests we can do with that specimen. FISH allows us to determine the number of copies of certain chromosomes. So you can see on the right here, on the far right, there are these pictures of fluorescent dye. This is a little difficult to see in the slide, but hopefully you can see it. There are here 3 red dots in the top associated with chromosome 21. And over here, there are 2 18s, 1 X and 1 Y. So this actually would be reflective of a boy with trisomy 21 or Down syndrome. But what this can tell us is how many copies of the sex chromosomes are present. And in the setting of an X-linked condition, this allows someone to know with pretty decent accuracy, is the fetus a genetic male or a genetic female within 24 to 48 hours of having done the chorionic villus sampling procedure. Again, this does not include analysis for the condition within the family, but it does allow for a quicker reflex testing. In other words, if you were only going to test a male fetus for the genetic condition in the family, then this allows us to tell you the genetic sex of the fetus within 24 to 48 hours, and then you can more rapidly reflex to the testing for the specific X-linked condition. Also available is a more detailed chromosome analysis. It not only tells you the predicted genetic sex of the fetus, but also looks for more subtle chromosome changes. These back and forth lines are small pieces of chromosomes in the red here on the right. And what you see here is this little bit of red off to the left means there's a deletion or a missing piece of the top of chromosome 4. This would be completely unrelated to why you would be having a CVS sample, but it does give you additional information about the potential genetic health of a fetus. The microarray analysis generally takes about 10 to 14 days as well. It might require some additional sample from the mother, and it cannot detect changes that would result in a normal amount of chromosomal material. It only detects unbalanced changes in the chromosomes or missing or extra pieces, but not pieces that are in different locations. Most pertinently, what we can do is we can do prenatal testing on the placental sample, the villus sample, for the specific X-linked condition in the family. And generally those results, depending on what the condition is and which laboratory is used, results generally take about 1 to 3 weeks. This also typically requires a blood sample from the mother. And the reasons for this blood sample would be either the need to have somebody who has that gene change to serve as a comparison to the fetal sample. In other words, a positive control for the laboratory to be able to say, yes, we see this variant or change in this gene in the mother. So now we know that if we don't see it in the fetus, our test worked. The blood test in the mother is also used to make sure that if the fetus is female, let's say, and the results are positive for being a carrier, we want to make sure that the test results reflect the fetus and not the mother, because we know in this situation, the mother is a carrier for the X-linked condition. So if the female fetus is also a carrier for the X-linked condition, we want to be sure that that result reflects the fetus and not the mother. This is called a maternal cell contamination test. Some important things to consider when thinking about chorionic villus sampling are, first off, it is done in the first trimester. So that is important in that if you're going to do testing during pregnancy, this is the testing that is the most accurate and the soonest you can do in pregnancy. The risk with the procedure is, however, about 1 in 300 for miscarriage, which is about 0.3% or 1/3 of 1%. Most people do very well after a CVS, but it is not without risk. Also, as I said earlier, the fetus and the placenta have the same genetic material 99% of the time. That means 1% of the time they don't. So about 1% of the time, we see that a placenta can have a chromosome abnormality that a fetus does not have. This is called mosaicism. Just like a mosaic tile art where you have different tiles making up one picture, this can be true of CVS, where you have different cell types making up one person. Some cell types might have 46 typical chromosomes and other cell types might have 47 chromosomes. This should not be an issue necessarily for the X-linked condition in the family unless the results show mosaicism for the X chromosome. Usually the mosaicism involves some non-X chromosome and is typically isolated to the placenta and not the fetus. But if you were to have a CVS and we found that the result from the CVS were mosaic or showed 2 cell types, we will recommend amniocentesis. When the results return, even though this is done in the first trimester, the results come back generally at the end of the first trimester. And then what are your options? For the vast majority of genetic conditions, including X-linked conditions, there is no in utero treatment options. So there's nothing we can do specifically to treat or change the outcome. And therefore, the options would be to continue the pregnancy and be prepared to raise the child with the genetic condition, or choose to terminate the pregnancy. Certainly, of course, there is the option for adoption, and that is something that's discussed in another module here. Of course, everything costs money, and genetic testing is not inexpensive. But if once you're pregnant, you have insurance coverage for maternity care, the cost of the CVS procedure and generally the benefits would be covered by your insurance. Some testing requires pre-authorization. And so your genetic counselor or your team that would be doing the procedure would generally assist in getting the pre-authorization if that's necessary. If not authorized, here is a list of estimated costs in the year 2022. The karyotype, or the first test, that's the basic look at the chromosomes, costs about $1,000. The rapid analysis for the number of copies of chromosomes 21, 18, 13, X, and Y is about $1,200. The more detailed chromosome analysis called microarray is about $3,000. And there's variable cost for the specific X-linked condition that on average ranges from $500 to $2,000. So this is quite a costly endeavor. But again, if you have maternity coverage for your pregnancy, then most of this will be a covered benefit. What are some next steps? Some next steps are that you could seek genetic counseling for a more detailed discussion of your family planning options by seeing somebody locally in your region, or you can speak to a maternal fetal medicine specialist as well. Best wishes.